Next, I will discuss the 3T MRI. Wooridul Spine Hospital has been operating a 3T MRI system for the past 3 years. As many of you know, German-made equipment is highly option-based. For example, in the case of a Porsche Cayenne, the turbo engine is significantly more expensive than the base model. If all options are added, the total price can be nearly twice that of the base configuration. MRI systems follow the same principle. The MRI installed at our hospital is the Siemens Vita, which is a high-end flagship model. This system offers 2 engine configurations, and we installed the highest specification, the XT engine. MRI image resolution is greatly influenced by the coil system. At Wooridul Spine Hospital, we upgraded to a spine-dedicated 72-channel coil. In this MRI system, the spine coil has 8 channels, and in another system, it has 15 channels. In contrast, our MRI uses a 72-channel spine coil. This is an MRI comparison of the same patient scanned on different MRI systems. When comparing 72-channel and 24-channel coils, it is clear that the 72-channel image provides superior resolution. This time, the images are from different patients scanned with the same MRI model. When comparing 72-channel and 32-channel coils, the 72-channel images again demonstrate superior resolution. Recently, with advances in artificial intelligence, deep learning techniques have been widely adopted in MRI. Deep Resolve Gain acquires a noise map during image acquisition and removes noise from the original data, resulting in clearer images. Deep Resolve Sharpness trains AI by simultaneously inputting low-resolution and high-resolution images. After training, the system can generate high-resolution images using only low-resolution input. Deep Resolve Boost inputs low-resolution images into AI and continuously amplifies the data, similar to PCR amplification, to generate high-resolution images. By applying these AI techniques, both image resolution has improved and scan time has been significantly reduced. At our hospital, the application of deep learning to MRI has improved image quality and reduced scan time by approximately 40% compared to previous protocols. Axial images also demonstrate excellent clarity. This paper, published last year, reported that deep learning technology can reduce scan time by approximately 60% while improving image resolution, thereby increasing diagnostic accuracy. Deep Resolve Swift Brain is an accelerated imaging technique specialized for brain MRI. It combines deep learning technology with simultaneous multi-slice acquisition, known as SMS. As a result, a brain MRI examination that previously required 30 minutes can now be completed in approximately 2 minutes. Although Swift Brain provides lower spatial resolution than conventional MRI, it is considered sufficient for diagnosing major brain pathologies. At Wooridul Spine Hospital, we use Swift Brain in emergency situations when a brain lesion is suspected. Recently, many local clinics have been promoting so-called Swift MRI systems. However, these systems are based on a different concept from the AI technology used at our hospital, and we do not use them. AI technology can be broadly classified into 2 categories. The first is online AI, which relies on internet connectivity. Although online AI is cost-effective, it carries the risk of patient data leakage. For this reason, online AI cannot be used in hospital environments. The second category is on-site AI, which does not require internet connectivity. However, this approach requires high-performance in-house servers and results in significantly higher costs. Deep learning techniques used in MRI can also be divided into 2 approaches. The first is the DICOM-based method. The Swift MRI systems used in local clinics rely on this approach, where images acquired from conventional MRI are later processed and converted on a server. In simple terms, this is similar to applying filters to an image using Photoshop. The second approach is the K-space-based method, which is the method used at Wooridul Spine Hospital and in most major hospitals. This technique amplifies raw data directly during MRI acquisition without post-acquisition image manipulation. With the installation of our highest specification MRI system, advanced imaging techniques have become possible. The first is T2 mapping. Among disc components, water is the most abundant, followed by proteoglycans and collagen. MRI allows quantitative measurement of these components, and recently, techniques measuring water content have been widely adopted. This paper demonstrated that T2 mapping can quantify chronic low back pain. Using this technique, we can measure water content in specific regions of the intervertebral disc. Additionally, color mapping allows visualization of water content, and T2 mapping can help predict degenerative spinal disease. The second advanced technique is flow quantification. This examination visualizes cerebrospinal fluid flow in the cervical spine. It also allows quantitative measurement of flow velocity and volume. CSF flow can be evaluated in various ways, including temporal changes in speed and volume. This patient has a C4-5 disc herniation. Flow quantification demonstrates blockage of CSF flow at the corresponding level. Some patients with cervical disc herniation experience headaches, which may be related to altered CSF flow. Recently, many studies have been published on CSF flow dynamics. This patient is suspected of having a CSF leak. Previously, diagnosis required intrathecal contrast injection. Now, flow quantification allows safe, non-invasive evaluation without contrast. Next is MR neurography. This technique directly visualizes nerve bundles. As shown in this image, each segment of the nerve is clearly visualized. In the cervical spine, nerve bundles appear especially distinct, making MR neurography very useful for diagnosing nerve compression. Previous studies have shown that MR neurography visualizes nerves well and is useful for diagnosing neuropathy caused by disc herniation. Recently, MR neurography has been combined with T2 mapping and diffusion imaging, including DTI, allowing assessment of both structural and functional abnormalities. Finally, I will discuss DTI imaging. DTI evaluates spinal cord pathology using the diffusion of water molecules and is useful for diagnosing myelopathy. In some cases, conventional MRI does not accurately reflect the severity of compressive myelopathy. In this patient, the spinal cord was severely compressed, but no signal change was observed, leading to underestimation of disease severity. After decompression surgery, previously undetected myelopathic changes became apparent. DTI consists of 4 components. The first is T2 weighted imaging to assess basic lesions. The second is tractography, which evaluates damage to spinal cord fibers. The third is diffusion imaging, which assesses whether the spinal cord is viable or necrotic due to compression. The fourth includes ADC and FA mapping, which quantitatively evaluate the severity of compressive myelopathy. Using these measurements, the severity of myelopathy can be expressed numerically. An FA value below 0.55 indicates myelopathy. In this patient, although the spinal cord was compressed at multiple levels, FA mapping showed myelopathy only at C4-5 and C5-6. Recently, these quantitative values have been visualized using color mapping to improve readability. As we all know, degenerative spinal disease is not a fatal condition. However, once degeneration begins, rapid muscle atrophy can occur, increasing the likelihood of disease progression. Additionally, accelerated aging may occur, leading to reduced quality of life. With aging, disc elasticity decreases. This results in reduced disc height, leading to foraminal stenosis and nerve compression. Loss of disc elasticity can also lead to disc herniation. Changes in disc height cause spinal instability, leading to hypertrophy of the ligamentum flavum and central canal stenosis. As instability worsens, increased stress is placed on the facet joints, resulting in arthritis and potentially progressing to spondylolisthesis. This instability can cause spinal deformity, vertebral fractures, and rapid degenerative progression. What is the goal of surgery or intervention in degenerative spinal disease? The goal is to slow these degenerative changes, essentially slowing the aging process. Pain and nerve compression limit activity and cause muscle atrophy, which accelerates degeneration. The goal of surgery is to relieve pain, decompress nerves, correct deformity, stabilize instability, and restore proper movement and function, thereby slowing degenerative progression. Therefore, the philosophy of Wooridul Spine Hospital is minimally invasive, root cause treatment that preserves normal tissue, especially muscle. MIST refers to minimally invasive spine surgery and treatment. The advantages of MISST include small incisions, reduced muscle damage, faster recovery, less bleeding, and lower infection risk. The disadvantages include a limited surgical field, which may increase the risk of incomplete lesion removal. Additionally, these procedures are technically demanding and require extensive surgical experience. Operative time may be longer and costs may be higher. In MIST, MRI at our hospital plays a crucial role by clearly visualizing lesions and anatomical structures for surgical and procedural planning. MRI helps determine whether surgery is necessary and whether a traditional or minimally invasive approach is appropriate. Accurate targeting increases surgical precision and enables personalized treatment. As a result, outcomes improve, complications decrease, tissue damage is minimized, recovery is faster, long-term results improve, and quality of life is enhanced. For these reasons, Wooridul Spine Hospital insists on using only the world's best MRI systems. There is one final important point. Trust between the patient and the physician is essential in treatment. Many studies have shown that stronger doctor-patient relationships lead to better treatment outcomes. Physicians at Wooridul Spine Hospital are highly dedicated to continuous study and have extensive clinical experience due to high patient volume. We hope that patients place their trust in our physicians. Although doctors strive to empathize, present hopeful treatment plans, and explain treatment thoroughly, their analytical nature may sometimes make them appear less emotionally expressive. Additionally, when physicians are deeply considering treatment strategies, concern may appear on their faces, which patients may misinterpret as unfriendliness. We kindly ask for your understanding. This concludes my presentation. Thank you very much for your attention.